Hey everyone, how's it going? I hope you're doing well. We're back with another video as promised. Last video I mentioned that the hospital is one of the most dangerous places you can be. And in this video, I'm gonna tell you how to stay safe in the hospital, because on average about 400,000 people die every year for avoidable reasons in the hospital, things like infections and medication errors. So we're gonna talk about those things a little faster today. I know the last video was kind of long, so we'll try and expedite this one and give you some good pointers. So let's cut to the videotape. All right, so here we are, 5 tips to survive your hospital stay. As I mentioned in the previous video, somewhere between 3 and 6 people per 1,000 that enter the hospital don't come out alive. So that actually ends up being somewhere between 1 in every 150 to 1 in every 350, depending on the quality of the hospital. They don't come out alive, and it's because of avoidable reasons, which in my opinion is totally unacceptable. In a future video, I'm going to talk about how to evaluate the hospitals that you may be going into. In certain situations, you're actually able to choose the hospital that you go to, and it does really make a lot of sense to go ahead and do some research before you're admitted to the hospital. But for today, we're going to talk specifically about 5 things, 5 tips that you can do for yourself or to help your family member prepare when going into the hospital. First and foremost, things that you can bring with you. There's 2 reasons why you want to bring things with you when you go to the hospital. One is because the stuff that you bring from home is probably going to be a whole lot cleaner than what exists in the hospital. And if it isn't technically cleaner, like, you know, bacteria-wise, it's at least the bacteria that you're used to in your own home. So by bringing these things with you, you help to lessen your exposure. And for the second reason, because having things from home with you in the hospital will help you to feel at home. It'll put you a little more at ease when you've got, you know, your own pillow that's just the right firmness, and you've got a comforter and your own toothbrush, because the stuff that they give you in the hospital isn't exactly the highest quality. So first and foremost, we're going to run through these things pretty quickly. They're relatively self-explanatory. There's a few that I want to touch on. You already understand the importance of having an advocate if you watched my first video. The second one is probably another one of those like things that you must have in your arsenal. And it sounds kind of crazy because it's a notebook, but just to give you a quick story, I was a nurse at the bedside for quite a few years. And whenever I would walk in a room, in a patient's room, and someone was there with a notebook, something changed in me. And I think my fellow nurses would agree. If someone were sitting there, you know, taking notes, asking me questions, what medication is that? You know, what's your name? And they were actively writing down notes about the things that I was doing, I would pay attention. And good, bad, indifferent, I don't think it really matters. The point of the matter is, if someone is there taking notes and in a sense holding you accountable for what you're doing, you're going to pay much more attention. So my advice to you as the patient or a loved one that is the patient, bring a notebook and write stuff down. I don't care if you're even just doodling in it. Sometimes just the act of actually knowing that someone is taking notes on your action really makes a difference. So of course I would suggest that you do write everything down as far as medication names and the people that are caring for you. But bring that notebook, and anytime someone comes in the room, take notes. It'll make a big difference. The last one I wanted to talk about is the last point there, and it is your inquisitive inner child. I don't care where you have to dig it up from, but go to that place and find your inner child. If you remember, you know, or you've been around a toddler in recent days, they incessantly ask why. And I feel like as a person in the hospital, asking why should be something that you do on a regular basis. Why am I getting that medication? Why am I going for this test? Why are you in my room? Why haven't you washed your hands? Don't push down that inner child. Constantly ask why and figure out what it is that's going on, why these people are in your room and what they're doing. If anything, much like the notebook, it will just get people into the habit of knowing that, okay, this is an inquisitive patient. This is someone that really needs to know what's going on. I am going to, you know, meet that person where they are and explain what I'm doing. And that will go a long way in putting you at ease, and holding the person accountable, that is caring for you. Okay. Adjust your attitude. Have you ever really thought about the word patient? It kind of bothers me. I have a problem with the word patient when it comes to defining someone that is receiving care. I actually try not to use it, but it's so prevalent that it's really hard to avoid. But when you think about the meaning of the word patient, it means someone who is, you know, calm and willing to deal with delays and willing to be, you know, passive. And honestly, that's the last thing you want to be when you're in the hospital. So tip number 2 is to adjust your attitude. If you're in a restaurant and someone, you know, brings you the wrong meal, or maybe you have an allergy, you wouldn't think twice about asking, you know, okay, what are the ingredients in there? Or, you know, my steak is undercooked and it's really not the way I like it. So you wouldn't think twice about sending it back. Use that same attitude when you're in the hospital. Don't feel bad about asking about medications or treatments. This is your life. This is your body. If there's any time that you need to be assertive, it's now. So find that assertiveness. Avoid the impulse to appease people and be polite. You don't want to be a pushover when you're in the hospital. If you have to fake it till you make it, because like I said, it's your body, it's your life, and the things that happen in the hospital can really have an impact. So be assertive. You know, don't overdo it, but as my former, or the instructor that kind of pioneered this whole patient advocacy thing, her name is Karen Mercereau, and she is an amazing nurse advocate, and she is the one that taught me everything I know about nursing advocacy. She would always say, big smile, feet don't move. So if there's something you're uncomfortable with, if there's something you feel isn't right, if there's something you're even just unsure of, you just smile and you say, you know what? I don't feel great about this. Can we talk about it? So don't ever hesitate to stand up for yourself, whether it be to the nurses, to the doctors, to food service, whoever it is. Be polite, but remember that your life is at stake here, literally. That third point, talking about, you know, a few different things here. Transparency is all the rage. Nowadays in medicine in general, there is a goal to be more transparent. So understanding why things are being done, something called shared decision-making, where, you know, the goals are discussed with the patients, and the patient and the doctor, or the patient and the practitioner talk thoroughly through all these things. So definitely don't hesitate to ask questions. Everyone should be willing to be transparent with you. If there has been a mistake made, it should be talked about. It's not something that, you know, we brush under the rug anymore. Which leads me to the second point there. Doctors and nurses are human. They're going to make mistakes. I have made mistakes. I remember them. They are burned in my brain forever, because it's something that we really, really want to try and avoid. But they're human, and you need to give them a little grace. So remember that. And sometimes it's okay to give those folks permission, you know, and let them know, I don't expect you to be perfect. I don't expect you to get, you know, everything right on the first try. Sure, there are certain things that you really want them to get right on the first try, but, you know, let them know that you understand that they're human and that mistakes happen. But if and when they do, we need to discuss them. And if there is something that can be done ahead of time to prevent that mistake from happening, let's have that discussion before, you know, we jump into the OR, or, you know, we draw blood. Or actually, one of the mistakes that I made that I will never forget is I was working in pediatrics, and I was rushing around, and I had a few different sets of lab work to take. And I took blood from a 4-year-old little boy, and I took blood from a 3-month-old baby, and I labeled them wrong. And let me tell you, getting that blood out of the 3-month-old baby was a horrible experience. But because I screwed up, I had to do it again. and I had to tell both parents what I had done wrong, and it was horrible, horrible, but nobody died. We figured out what went wrong. I owned it. I explained it to their parents, and thankfully, we were able to move past it. And I feel like because I admitted that I made an error, I was able to gain their trust a little better. At least they understood that I was human. And that last point, be realistic, plan ahead. Things in the hospital take time, like 3 times as much time as they would in the normal world. If pain is an issue for you, you need to preemptively think about that and know that you have an order for pain medication. If you're hungry, this isn't McDonald's, you can't drive through and grab something quick. So you really need to plan ahead and be realistic about the time that it's going to take. Chances are, if they tell you you're going to be discharged, you might as well tack on 3, 4, 5 hours to that, because discharges take forever. So yeah, just being realistic about what the expectations are. Mastering medications. So like hospital-acquired infections, mastering medications or medication errors is one of the leading causes of avoidable deaths while patients are in the hospital. So there are a few points here that really, it's in your best interest to do actually each of these things. But definitely pay attention when it comes to medication administration first. You should always have a list of the medications that you take at home on you at all times. Heaven forbid there's an emergency and you're not responsive when you're on specific medications, one of them being insulin. Emergency responders need to know it. So make a list, keep it in your wallet, keep it in your purse, keep it updated, but definitely bring it to the hospital with you. Every morning when you're in the hospital, something called a MAR, a medication administration report, prints out. And if it doesn't print out automatically, your nurse knows where to find it. So get that list, have it at your bedside, compare your list from home to the list of what's in the hospital. And if things don't jive, start asking questions. A great resource also, if you're going to be if they're starting new medications, is drugs.com. Drugs.com will give you all the information about dosage, interactions, side effects. You can find out a lot of information on drugs.com. So get your medication administration report each morning. When you're there initially, compare it to what you have from home and make sure that everything is in line with what you know about. And then that medication administration report will tell you when you should be receiving those medications. So as I mentioned, things are not going to happen on time in the hospital, ever, probably. But give that nurse a little grace. If your medication administration report says you're supposed to get your Dulcolax at noon and she's not there until 1, give her a little grace. But when that nurse does show up, an hour either side of the administration time is usually acceptable. Ask him or her to bring you the medications and open them in front of you. Long gone are the days where a nurse would just walk in with, a cup full of pills and they would put them all out on your table and you'd take them in one fell swoop. Nowadays there are, the name bands that have to be scanned and specific medications have to be scanned and so forth. So make sure that the nurse is going through that process and that you're able to identify each medication, because the medication you take at home may be the same medication you're taking in the hospital, but if it comes from a different distributor, it's going to look a little different. So, when you're used to seeing pills a certain way, it probably won't be the same in the hospital. But if you have them labeled and they're coming out of the actual original packaging, you can be at ease that you're getting the right medications. And when we talk about right medications, there's 6 rights when it comes to medications. 1, the right patient, you should know who you are. 2, right medication. So having that list at home or having a justification as to why the doctor started you on a new medication. The right time, of course, with some understanding that not everything is going to be on time. The right dose. So if you know, you're taking 25 milligrams at home, you should be taking 25 milligrams in the hospital, unless there is an indication to either increase or decrease your dose. And in that instance, the nurse should be able to explain that to you. So right indication, and finally right route, meaning if you take something by mouth at home, you'll be taking it by mouth in the hospital unless they've changed it to IV or, you know, an injectable something. So those things: route, dose, indication, time, medication, patient. Standard nursing protocol. No one should be offended if you ask about those 6 things. And finally, a point about insulin. If you are diabetic, or if you're having blood sugar issues in the hospital and you're newly receiving insulin, or if insulin is something you've always taken, insulin is a very dangerous medication, specifically when you're in the hospital, because the dose changes every time you're getting it, because it's based on your blood sugar. So there are so many errors that happen with insulin, and an overdose of insulin can be fatal. So this is an area where you want to be super vigilant. Again, you kind of go back to that medication administration report, and there should be a chart there that says, you know, a dose range. If your blood sugar is between, you know, 120 and 180, give, you know, 2 units. So you want to make sure that, for one, you know, you're getting the right type of insulin, whether it's long acting or short acting. You want to make sure that you physically see what your blood sugar was, and that the dose that you're getting falls within the range of your dosage that has been prescribed. So it's definitely, insulin is one of those areas where you want to pay attention very carefully, and you want to be in control of that situation. Just as a reminder, 1 in every 20 patients will experience a medication error in the hospital. Don't be one of them. Be hypervigilant about all of your medications. The nurse won't be mad at you for it. You know, if anything, I would give those patients a high five. They might take a little extra time, but I have the utmost respect for patients that take control. Number 4, own your hygiene. So the 2 main reasons people die in the hospital, one of them is medication errors, 2 is hospital-acquired infections, things like UTIs, things like central line infections, and general, you know, bacteria. Clostridium difficile is one that gets passed from patients like wildfire. But there are ways to prevent these things, and we're going to hit on them quick. 2 points. Everything that touches you gets cleaned first, and it gets cleaned in front of you. Everything that goes into you gets changed regularly and gets cleaned regularly, one or the other. So basically, what's going to be touching you in the hospital? The doc's going to come in and feel your belly. The nurse is going to come in and, you know, adjust your sheets or whatnot. Hands need to be cleaned every time someone walks in the door, whether it's a nurse, whether it's a doctor or a loved one. Anybody that's going to be touching you or touching your stuff, touching your bed, touching the remote, they need to wash their hands, and they need to do it properly. There should be a sink right there in your room where hands can be washed in front of you so you can see it. Stethoscopes harbor tons of bacteria because people run around slinging them from patient to patient. They're being placed right here on the chest, which is right in line with, you know, everything that comes out of your mouth, everything that comes out of your nose. If, you know, when I worked in open heart surgery, patients had, you know, their chest just split open. So here is this open wound essentially, and a stethoscope is being placed all over it. Definitely not something you want dirty being placed directly on your skin when you're potentially in an immune compromised situation. So make sure they wipe down their stethoscope with one of those disinfecting wipes that you brought from home, because you don't ever want to run out. Blood pressure cuffs. Nowadays, each patient should have their own blood pressure cuff. It should be, you know, kept somewhere in your room. If that's not the case, and if the nurse's aide is coming around with a community blood pressure cuff, ask them to wipe it down with a disinfecting wipe before it gets anywhere near your body. And a hint about these disinfecting wipes, specifically when it comes to alcohol swabs. The act of actually wiping something down is not the disinfecting piece. Something has to be wet with the disinfecting liquid, and then it has to dry in the air. It always makes me crazy when someone comes in and they, they're about to take blood and they wipe your arm with some alcohol and then they wipe it off with the gauze. You just completely blew the whole sanitization process out of the water because you just reinfected the area with the gauze. You wipe it with alcohol, you let it air dry, you don't blow on it, none of that stuff. So when it comes to wiping things off with the disinfectant cloths, they need to wipe it off, let it dry, and then they can put it on your arm. I'm telling you, adjust your attitude, be annoying, it's going to save your life. TV remotes, phones, bedside rails, on a regular basis, wipe them all down. It's good. It's good for you. Nobody will complain. Trust me. It'll put you at ease. It'll put me at ease. So everything that goes into your body needs to get changed regularly as well. Things like IV tubing, central lines, catheters. Every day you need to ask, do I still need this IV? Do I still need this catheter? Is this central line still being used? If they're not being used, if they're not needed, you want them out, because any hole in your body is a route for infection. And the last thing you want is to get a serious infection, specifically sepsis, related to any of these things that are, protruding into your body. Not to mention that it's a foreign body, so that's going to cause an immune response in and of itself. IVs and tubing, they should be changed every 72 to 96 hours. Central lines are a little more complicated. The line itself stays in for basically, as long as it can. Sometimes they're in for a month or more, as long as they're clean, but the gauze around the dressing should be changed every 2 days. The tubing leading to the line that goes into your artery, your chest, wherever it is, that should be changed every 4 to 7 days. And then there's going to be there's the tube itself, there's a gauze, and then there's a clear dressing that covers it. That clear dressing needs to be changed every 7 days. But if at any point any of these things become soiled or funky, you can request to have them changed. You shouldn't be running around with a nasty dressing. It just shouldn't happen. And oftentimes, if you can't remember when the dressing was changed, it should be labeled. And don't hesitate to ask, when is it still necessary? When's the last time it was changed? And when will it come out? And that last point there, if anything looks, feels, smells funny, let somebody know. You don't want it to be a source of infection. If it has to be changed, yes, you may have to get stuck again. And sometimes nurses will say, oh, it looks good, I don't want to stick you again, like they're being all nice. No, get it out and get me a new one. I know you might need to look for 20 minutes to find a vein, but if it's going to keep you safe, it's going to keep you healthy, it's worth a little pain. So this last slide, it kind of wraps up everything that we talked about previously. Be good, memorable, and slightly annoying. Take notes on everything: names, medications, tests, treatments, vitals. Write it all down. If anything, being a note taker will make sure that the person giving you care is on point and accountable. Talk to everyone. Even if you're not a social butterfly, if you're not an extrovert, I can tell you right now, talking to everyone, connecting with them on a personal level will up the ante when it comes to taking care of you. I know this from experience. I know it from, there's plenty of research out there as well. My stories are somewhat anecdotal, but there's actual proof to back this up. When you have a personal relationship with the nurse, with the doctor, even if they know your kid's name or they know that you like dogs, if you're memorable and relatable, they're going to treat you different. And I almost feel bad talking about it this way, but it's absolutely true. I know it from my own personal experience. I know other nurses would say it again. There are, a dozen patients that stand out in my head that I had some sort of connection with. And I would go to the ends of the earth for these patients. So you want to be one of those patients. You want to be a memorable patient. Make yourself memorable. Do it. Ask questions about everything. In the morning, your first questions would be, so what's the plan for today? What's the goal for today? What do we got going on? Am I getting that CAT scan? So on and so forth. Medications, ask questions. Anytime you're getting a test, what is this test for? You might want to hear it from a few different people. The nurse might explain it a little differently than the doctor, and that's okay. But you want to understand what it is for. When someone you don't recognize comes in the door, ask them. 1, go wash your hands. 2, who are you and why are you here? You might want to do it with a little more class, but maybe it's a physical therapist. Maybe it's someone that's in the wrong room. You never know until you ask. So ask who you are and what their role is in your care. Something you kind of want to do from the start is have a good kind of lay of the land, some good ground rules. What do I do if I have pain? What do I do if I need to use the bathroom? If you're, hooked up to a bunch of stuff, it's not a good plan to try and get yourself out of bed into the bathroom. And again, thinking back to how long it takes to get things done in the hospital, you need to call somebody when your bladder is about half full, because the last thing you want to be doing is rushing to the bathroom with a full bladder, IV poles and blood pressure cuffs and everything. So plan ahead. And then also, if you have an emergency, if you're feeling faint, if your friend is in the room and you pass out or have a fall, aside from screaming bloody murder, what is it that person needs to do to activate either the emergency response system? Maybe a visitor can activate a rapid response. Those sorts of things are really important to know from the start. Don't be intimidated to ask about abbreviations. When I was in the military, I thought we had a whole lot of abbreviations, but holy cow, are there a lot more abbreviations in the hospital. So don't hesitate to ask, what does CPAP mean? What is a MAR? What is an LVAD? All those things, you want to know what those words mean so you can speak the same language, because understanding what they're talking about is a big part of feeling empowered and in control. Again, that question, don't hesitate to ask, your caregivers. So do you have any kids? Do you have any pets? Making yourself memorable, and you also want to get to know them as well. So it's all about relationship building. You're going to have a much different experience dealing with someone that you feel like you have a relationship with or that you've connected with. And finally, when it comes to having procedures and things in the hospitals, surgeries and certain tests, you're going to be asked to sign a consent. I'm going to make another video all about consent specifically, but it is so important to make sure that you understand what's in that consent and what you are consenting to. So don't hesitate. This isn't like buying a car and you're not going to read all the fine print. This is your life. Read the fine print. Understand what your options are, what the risks are, who's going to be doing the surgery, because it may not always be the doctor. Sometimes they, bring a resident in and practice on you. But yes, so there it is. 5 tips for surviving your hospital stay. This quote really hits home for me. He who has health has hope, and he who has hope has everything. I believe that through to my core, and hopefully understanding how to survive your hospital stay will give you a little more hope and will bring you all health. Because I don't want you in the hospital to begin with. But if you do end up there, I want you to be safe. And I hope that these tips have helped you. Till next time, thanks everyone.